welcome to What You Need to Know with Carla Pileggi Caviola. Today on our show, I will be talking about perinatal mental health. And as you know, I am a psychotherapist and perinatal mental health specialist, in addition to Maxwell certified team coach, teacher, trainer, and speaker. So how did I get into this work? Well, I have been a psychotherapist since 2028 when I finished my master's degree. And when I had my first pregnancy, that ended up in a miscarriage. My second pregnancy went well, and postpartum, I had unexpected stressors with breastfeeding complications. My daughter at the time was not gaining weight as needed, and I also ended up having some intrusive, scary thoughts that I knew was not anything that I, wanted to do or anything like that, but it was kind of like intrusive, scary thoughts of kind of harm coming to the baby. In addition to my own story of unexpected stressors and intrusive thoughts, I also met a lot of other moms that at the time were going through something, and certainly everybody has their own story. And as I kind of met with people, connected with friends and colleagues and so forth, I realized that even though our stories were different, we were all kind of going through different things. And my eyes were completely open to what women and families deal with during this season, during pregnancy and the postpartum period, or the perinatal period is what we call it. So I really just felt called into this type of work. And certainly after that, so that was 12 years ago, I started doing courses and completing certifications and things like that, as a specialist in perinatal mental health. In 2021, I also was certified as a coach, teacher, trainer, and speaker. And before and after that, had also been doing speaking events and training events, especially in this field, which is, obviously something I'm truly passionate about. Some of the common challenges that people might experience during this time period are certainly related to a lot of changes that happen, right? For some women, conception is also can be challenging and can lead to infertility treatment, which comes along, which certainly can be an emotional roller coaster. You can also check out my previous episode with Dr. Ana Flores Locke, who is a Latina fertility specialist, where we go more in depth into that topic. Some people also experience with a sudden surge of hormones during pregnancy. Sometimes that can affect their mood, although many women do feel better or feel good emotionally. Some of them do experience depression and anxiety. There can also be anxiety based on previous losses and so forth in pregnancies. And then certainly upon delivery, after, pretty much hours after, hormones crash out, and, it takes about 6 weeks for them to start coming back up again. And just due to that hormonal crash postpartum, whether it's a vaginal or C-section birth, women often will experience a shift, right? So a lot of people experience the baby blues, which is typical, again, due to that hormonal crash. And women might feel teary, weepy, not quite themselves, kind of more reactive emotionally and so forth. But beyond that, past that 14-day mark, if women aren't feeling kind of irritable, sad, down, they would, it could definitely at that point past the 14 mark be more of like a postpartum depression. So we always look at severity, timing, and then the symptoms as to what's going on. Some women also experience stress, right? I had some unexpected postpartum stressors, as well as anxiety. Some women have anxiety in addition to what we call, OCD, which is more about intrusive thoughts, scary thoughts, typically related in this period of time, related to the baby, or harm coming to the baby, things like that. In addition to, for some people, it can also manifest in compulsive behaviors, but more often than not, it's more of just the intrusive thoughts that keep looping in the head. right? Which cause women to feel anxious and obviously somewhat miserable due to that. Some women also experience their first panic attack if they haven't had any before. Again, consider all the changes that are happening, considering, you know, everything that's going on during this time period. So it can be certainly overwhelming. And for some women, that can also include post traumatic stress symptoms, post traumatic stress disorder, PTSD, and it can definitely be directly correlated to traumatic births, whether again it's a vaginal or C-section birth. And certainly for those situations, we always want to do some trauma work in regards to PTSD symptoms. And certainly partners can also have PTSD from, secondary trauma, whatever they might have witnessed and so forth. And certainly people might have their own personal history, right? Of any kind of mental health history and family history as well. So again, we're just looking quite briefly at the emotional complications spectrum, which also leads us to postpartum psychosis, which is really when women might develop symptoms of psychosis or delusion. So during this time period. Okay. And the good news is, and we're certainly going to go more in depth into this topic in a further episode, is the good news is that it is treatable and it's also preventable. When people know their personal mental health history, in addition to their family health history, it helps us to see what kind of a risk factor there is here to developing postpartum psychosis, which again, we often hear about that when there's those sorts of really tragic endings where, a mom might kill the baby or children in addition to also killing herself. So again, there's a high risk with postpartum psychosis of suicidality and homicidality. In this case, infanticide is what we call it. Okay. And because of this high risk, again, this is why we always want to try to, if possible, know your history before, know your family history before, because we can, in fact, anticipate this and really implement prevention in addition to, should somebody experience these symptoms, obviously there's treatment available before it gets to, some sort of tragedy like that. So again, it's so important for us to know when it comes to all of these emotional complications, number one, our personal mental health history, our family mental health history, because that can certainly play a part, in addition to any environmental stressors that are happening, currently, in addition to sometimes things that just pop up out of the blue. And, again, that could be anything from medical situations and health of self, baby, family, to, relational stressors and so forth in the family dynamic, finances, whatever it could be. These can make these these can also filter into, obviously, factors that can lead to these sorts of emotional complications, right? And certainly there's a lot more, but we're just, we want to help you be aware of this so that you can be more prepared and empowered to get help should you need them, right? To understand what these emotional complications are and to be able to make the right steps to getting the help as soon as possible. So we want to kind of nip it in the bud so women can really feel more like themselves, and partners as well. In addition to, moms, dads can also have postpartum depression. 10% of dads actually do have postpartum depression. They can also experience stress, anxiety, also intrusive thoughts, so OCD type of thoughts and compulsions, in addition to, like we mentioned before, post-traumatic stress disorder, from trauma and things. And again, these are things for us to be aware of, not just dealing with moms, but the fathers and just the partners, and for families when working with families. So these are definitely challenges that can present themselves. And it is so important to seek out a specialist, a perinatal mental health specialist, which will help you with getting the help that you need to feel like yourself as soon as possible. Okay. And the reason I say perinatal mental health specialist is because as perinatal mental health specialists, we are trained to not just deal with the client, whether it be the mom or the couple or, the family dynamic, but we're also dealing with the developing fetus, newborn, infant during this time period. So we're really looking at the whole, whether it's a dyad or whether it's the whole family dynamic. Okay. And just knowing what to look for, knowing the questions to ask, we're able to help people more effectively feel more like themselves and be able to overcome and move towards their goals. So sometimes we see women or families also not seeking out treatment, and some of those barriers might be certainly finances, although there are definitely a lot of resources, and including a free resource, Postpartum Support International, which also does free online support groups. So in this case, there's support groups that are online. In addition to that, sometimes there's still stigma in relation to mental health, and sometimes family messages like pull up your bootstraps, just snap out of it, get over it. There could be cultural influences that can certainly hinder people from getting the help that they need and deserve, in addition to sometimes maybe not knowing where to find these providers, or maybe living in a rural area and not feeling like there's anybody in your area. But the good news is that ever since the pandemic hit, we now know that telehealth is actually very effective, and virtual support is effective, whether it be counseling, coaching, depending on the severity of what's going on. We typically say in regards to perinatal, emotional complications that can occur, the first line of treatment is psychotherapy, and from mild to moderate symptoms, and then moderate to severe, certainly psychotropic medications or psychiatric treatment that can complement with this, in addition to obviously positive supports in your life. Could be family, friends, community groups that you're involved with, church, synagogue, mosque, whatever it might be. So just regarding anyone that might be viewing this video, or anyone you think that might be struggling, the most important thing that you need to know is that you don't need to go through this alone, that with help and with specialized help, you will feel better quicker. Nobody needs to suffer in silence. And that is the main message that, certainly I want to encourage everybody on. If anybody is looking for help finding a provider that, again, is specialized in perinatal mental health, they can go through Postpartum Support International. That is postpartum.net, and they can find individual providers that will help them individually, as well as groups and so forth. There's also a helpline there, and that is a great resource. If anybody would like to reach out to myself in regards to the individual and group support that I offer, or including coaching, speaking and training events, including specialized customized events, you could certainly contact me through my email, which is Carla, CARLA, at waveridersglobal.com. That's CARLA at waveridersglobal.com. In addition to my private practice, I also do, like I said, coaching, speaking, and training to help, bring forth this message of education, empowerment, and helping people to move towards health and well-being. Certainly, when it comes to perinatal mood and anxiety disorders, again, we talked about mild to moderate symptoms, first line of treatment, psychotherapy, and then moderate to severe, the medication might be also complementary treatment, and those are the best treatments for that level of severity. And coaching can also be helpful in regards to bringing you from one point to the other. Coaching is not really so much about healing from the past. We can look at the past and we can learn from the past and extract those lessons, but it really is more about where we are right now and helping us to move forward to where we want to be based on the client's goals. And so that's another just differentiation in regards to the counseling versus the coaching, right? Counseling is more past, present, future, but it includes healing, whereas coaching is very transformational in regards to kind of where we are and where we want to get to. So obviously, should there be any more severe symptoms, especially when it comes to postpartum depression, those severe symptoms might include something like thoughts of death or dying, as well as suicidal thoughts or plans. Certainly, if somebody does have any plans to harm themselves, one must immediately call 911 or the emergency number in your state, province, or country, or go to the nearest emergency room. So that is definitely a safety protocol in regards to anyone that might be having any thoughts of harming themselves or others. And not just the thoughts, but the plans. Okay. So one might have thoughts, but no plans. They still need to get help, right? Again, first line of treatment, psychotherapy, and then obviously medication. It sounds like if that's more, those symptoms tend to be more severe, so they would probably need that combination. But should they have plans of harming themselves or others, they need to call 911 or the emergency number in their state, province, or country, or go to the nearest emergency room, because safety really is the most important thing. We need to make sure people are safe, right? And so that is the protocol for whether it be, depression, harming self, or whether it be in extreme cases, again, the, postpartum psychosis, which again could lead to suicidal thoughts, plans, and infanticide thoughts and plans of harming the baby, plans of harming children. So in this case scenario, again, I just want to really reiterate, and those are emergency situations. And should that be the case with anyone, we want everybody to know the right protocol. The safety plan would be to call 911 in your state, province, or whatever that mental health emergency line is, or go to the emergency room. Again, more often than not, that is not maybe what everybody might be experiencing, but we do want to include that in this episode, because people need to know what to do should somebody be at that, in this sort of experiencing these types of symptoms. Okay. So it has been truly amazing being with you guys today on this episode. And I hope that you have gained some clarity regarding perinatal mental health, and certainly the emotional, the spectrum, like we talked about, the spectrum of emotional complications that can occur during pregnancy and the postpartum period. Keep in mind, it's not just the mom. Partners can also have these complications, in addition to any parents, including adoptive parents. If you would like to be in touch with me, again, feel free to reach out. Carla at waveridersglobal.com would be the best way to reach out to me. And if you have found this time to be educational, empowering, and insightful to your health and well-being, please click on the button below to subscribe to my channel. Lastly, please feel free to share this with your friends and family and anyone who would benefit from today's episode. Thank you so much for tuning in, and I look forward to sharing what you need to know next time. Take care and be well.